I'm going to be leading the session, and I'm also joined by my colleague Ellie, who will be kind of monitoring the chat, hopefully answering questions if there are any. And it's really lovely to have you join us. So what we want to kind of cover today is a bit about the deep dive program itself. So to introduce it for those of you who haven't heard of us or our work. Actually, it'd be really nice if people could put a thumbs up in the chat if they have heard of our team or our work before, or the deep dive program or any of our other reports, because it'd be really nice to see if there's other people there that are familiar with the work. Okay, a few thumbs up, that's good to know. I'll also talk about the Learning Disabilities deep dive. That's what we're here to find out about. There will be a time for questions, and then I also want to point you towards our current and future work and opportunities to collaborate, because we're really keen to talk to you about the work that we're doing and get your input. I've included a couple of the quotes from our lived experience commissioned research into this slide, because I want to integrate the voice of our citizens as much as possible throughout this presentation. So you'll see these quotes come up, but the two that I've put on the screen here really illustrate one of the themes that came out from our research about parents feeling like they needed to fight for the support that their children needed. So that top one there is a parent saying that they would need to know that their daughter's safe, someone is fighting her corner, know that she's being listened to, and knowing she'll always have somewhere to call home. And that second one, I'm constantly having to fight to support my son's needs. So that's a theme that will sort of crop up a bit later in the presentation, but hopefully you'll kind of enjoy seeing that lived experience throughout the slides as well. Hi to those of you who've just joined. I'm just starting up. I was just introducing myself, Beth, as a member of the deep dive program team. We're called the evidence team in public health, and I've got a bit of an explanation about our work just to start off with. So we are a team in public health that carry out the deep dive program. This is a rolling program of in-depth needs assessments, which are chosen by the Health and Wellbeing Board based on need, and they support the joint strategic needs assessment. So hopefully the JSNA is a familiar term to some of you. And in the past, we've published topics such as veterans, end of life, and of course, learning disabilities, what we're here to talk about today. But we are also awaiting publication for two further topics, which are dual diagnosis, which is the coexistence of mental health and substance use, and mobility impairment. And we also have some ongoing work on our current deep dives that we're really, really excited about, and those are on neurodiversity and work and worklessness. So we'll talk a little bit more particularly about neurodiversity at the end, but we're really keen to connect with those of you who would be interested in sharing your thoughts and insights about what we should be including in our neurodiversity report in particular. So there will be an opportunity at the end to share your email address in the chat if you want us to get in touch with you about that. So yeah, that would be fantastic. We like to have this little analogy of an iceberg to describe what our team does. Where we are a team that conduct research, and like I said, we sit in public health and are in charge of the deep dive program. And so we might know that there's an inequality, such as for citizens with learning disabilities, and that's what we can see above the water. But our role as a team is to deep dive and uncover the full picture of inequality where possible, health inequalities, wider determinants of health, to understand the lived experience of our citizens. And that's really kind of the meat of our work as a team. And that's really important because all of that goes towards creating recommendations for action, which are taken forward by stakeholders in this area. So I'll get on to our learning disabilities deep dive itself. We used this definition on the screen, which is from MenCap, that a learning disability is a reduced intellectual ability, difficulty with everyday activities, for example, household tasks, socialising and managing money, and it affects somebody for their whole life. We know that there's over 1 million people, and that's children, young people and adults with a learning disability in England. But we know that not necessarily everybody is on their GP's register. So Public Health England estimated that only about 23% were on their GP's learning disability register. So we know that there's people out there that maybe have unmet need. So in terms of prevalence in Birmingham, what I've tried to do is give some highlights as to the inequalities that our report shows, but I'd really encourage you to see the report for the links that Ellie's put in the chat to really give the kind of fuller picture and to read the extended version, because this really is just the highlights. But in Birmingham, we've got over 10,000 patients with learning disabilities on GP registers, and that this data was from when those registers were aged 14 plus. We know that overwhelmingly these citizens are male. And one of the significant themes that came out in our report is the significant burden of health inequalities that individuals with learning disabilities endure. So LEADER reported that at the time of death, 46% of citizens with learning disabilities had 7 to 10 long-term health conditions. I've mentioned LEADER, so I'll briefly explain who they are. They are a national program that aims to improve care, reduce inequalities, and ultimately prevent early deaths for people with learning disabilities and now autism. So where there is the death of a person with learning disabilities and or autism, and that death is notified to LEADER, they review significant points of health and social care running up to that person's death to understand areas for improvement and examples of good practice as well in someone's care. Another inequality that is really, really important to highlight is that inequality in cancer screenings. So fewer people with learning disabilities access cancer screenings than the general population, and the percentages on screen, they're quite staggering. So for breast cancer screening, 38.8% of those with learning disability accessed a cancer screening, and that was compared to nearly 54% of the general population. And for cervical screening, again, it's much lower in those with learning disabilities, so 31% versus 61%, so a huge inequality there. But of course, no presentation on the inequalities for those with learning disabilities can go without mentioning the huge inequality in life expectancy. So in the West Midlands, life expectancy is only 59 years for those with learning disability, and that's significantly different from the general population, where it's nearly 79 years for men and nearly 83 years for women, so hugely different there. Continuing the theme of talking about health inequalities, we know that citizens with learning disabilities have significant comorbidities, and 37% also have autism. 9% have Down syndrome. And this table highlights a range of health conditions that those with learning disabilities may be more likely to experience. Things like having asthma at 19%, epilepsy at 19%, depression at 16%, diabetes at 9%. And notice that dementia there, it's at 1%, and that's even in light of the earlier life expectancy. So really significant as well. I should say that was local data as well. It was from the Birmingham and Solihull's ICB. There's also a significant inequality in terms of medication. So Public Health England estimated that 30 to 35,000 adults with learning disabilities are affected by widespread prescribing of psychotropic medicines. And locally, we know that citizens with learning disabilities are much more likely to be prescribed things like antipsychotics, antidepressants, benzodiazepines, and epilepsy drugs. Now, by psychotropic medicines, what I mean is medicines which treat depression, psychosis, anxiety, sleep problems, epilepsy. And the national programme STOMP, which stands for Stopping the Overmedication of People with a Learning Disability, Autism or Both, is a national project that aims to look at this inequality in these prescriptions and to address this. So we know that sometimes people who display challenging behaviour are prescribed these medications, and individuals with learning disabilities are more likely to be prescribed these and at a higher dose. So while they are definitely appropriate for many circumstances, there's this issue here of those with learning disabilities having higher doses, being prescribed for longer, and being prescribed much more than the general population. And they have negative side effects as well, such as weight gain, feeling tired, and coming to other physical health problems. So in terms of wider determinants of health, and what I mean by wider determinants are things like housing, education, employment. We know that local authorities in the UK report really low levels of employment among individuals who are of working age with learning disabilities. So in Birmingham, we report that just 1.4% of those with learning disabilities are in paid employment. And that's much lower than the England average at 5.6%, which is still terrible, but 5.6%. Other core cities are slightly different. So the highest of the core cities is Leeds at 8.1%, and Manchester was the lowest at 0.9%. MenCap have run a survey to explore the barriers to work for people with learning disabilities. And this found that difficulty filling out application forms was one of the key barriers, and 30% of their survey respondents highlighted that as an issue. And that was really interesting because that came out in our own commissioned lived experience. So I said these quotes would pop up throughout the presentation, and this is one of them. Here a citizen is saying, I can fill in forms to a certain extent, but as soon as they get too wordy, I really struggle. It's affected my confidence with applying for jobs. So that was really interesting to see those overlaps between research which had been conducted by MenCap, but also our own citizens. Transport was said to be something that was a key inequality among Birmingham professionals. And we know that that is something that, lots of our citizens also said. In 2022, Birmingham City Council launched an independent travel training programme, and that was a free scheme to support children and young people to develop independent skills with travel. This, along with many other services, was highlighted in our services chapter of our deep dive, where the team carried out a service mapping exercise, so I'd really encourage you to take a look at that, because that kind of really highlights national but also local things going on. And finally, with education, it's really important to note that fewer pupils with special educational needs, so that's a term which is broader than just learning disabilities, but does include children with learning disabilities, achieved the expected levels of reading, maths and writing. So 22% compared to 74%. And unfortunately, I can't break that down any further in terms of the data, but it does still speak to that inequality there. So I did want to provide an example of where the statistics are good. I didn't want it to all be doom and gloom. So in terms of annual health checks, this is something that all citizens with learning disabilities are entitled to receive from their GP. And in between 2018 and 2019 and 2020 and 2021 in Birmingham, we know that there was a huge increase in the number of citizens with learning disabilities accessing these. So it went from 59% to just over 75%. So that was really positive. Social inclusion and social exclusion were themes which came out in our report, and I wanted to highlight this through the words of a health professional who said that I think the key factors that people with learning disabilities face are public ignorance and a lack of education and understanding. In terms of the criminal justice system, we know that people with disabilities may be more likely to experience certain types of crime than those without. So for domestic abuse, 14% of those with disabilities experience this, compared to just 5.4% of the non-disabled population. And again, disability is a term which is much, much broader than learning disabilities, but we didn't have that data at a more granular level. So that's really important to kind of still include. So I wanted to mention that. And in terms of young offenders, so we know that nearly half of young offenders had a special educational need in Birmingham. And that's really significant because that's, again, wider than learning disabilities, but that's what we had the data for. So you'll see throughout our report, we've included data where possible on just learning disabilities, but it's not always possible to access later at that granular level. So we've had to use things like disability data and special educational needs data as well. So I wanted just to slow down for a second and give some more of the lived experience quotes, which really highlight some of the themes which came out in our reports. So first of all, in terms of accessing healthcare, one citizen said that a massive positive experience at the GP was when the doctor gave them time and listened to them and their dad. So, that speaks to kind of one of the reasonable adjustments people with learning disabilities may be able to receive, which supports their access to healthcare, is that additional time. In terms of the accessibility of society, one health professional said that society just doesn't feel set up for people with learning disabilities. Things like transport and reading letters, these are all just things which are inaccessible. And in terms of services, parents here have said that it feels like you don't want to tell other people about what support's available, in fear that resources will be overstretched and you'll lose out on support. So that really speaks to this feeling that, services are stretched. And people did have really lovely things to say about services when they did have access to them. So for one person there is saying they felt really lucky. They had lots of support and help with transition. Transition was a time where lots of families reported quite great difficulty. That difficult experience moving from children's to adult services, which was really, really interesting to hear about. And lastly, there, a parent saying that they feel the inequalities their child faces would be far worse if his parents weren't around to fight for him. And again, that theme comes up of parents feeling like it's a fight, that they need to really push for the support that their children need. So I've mentioned that we've carried out commissioned lived experience, and this was really important to us because we've really wanted to hear from citizens, parents, and professionals to understand about the inequalities people feel like they're facing in Birmingham. We commissioned a daycare centre in Birmingham and Midland MenCap to carry out focus groups with citizens with learning disabilities, including those with a co-diagnosis of autism, but also parents of children and parents who they themselves had learning disabilities as well. And like I said, professionals. We also commissioned Easy Read Online, who were an organisation that we've worked with to help create easy read versions of our materials like the information sheet and demographic questionnaire. And just for the benefit of everybody, Easy Read is an adapted form of communication which is simpler to understand and can be useful for some people with learning disabilities. So like I said, the lived experience really fed into the development of our recommendations, which we worked with stakeholders on. And we had recommendations that were split into 4 key findings, which had recommendations for action in this deep dive. And we agreed with stakeholders to take forward ownership of these. And I'm just going to share a couple of the recommendations associated with each of the key findings, as well as a quote which I feel really illustrates something of the sentiment of that key finding. It's important to say that our work also influenced the development of the Birmingham and Solihull Learning Disabilities and Autism Framework for Transformational Change. So that's really important to say as well. So our first key finding was that there was a demand for strengthening the whole system approach, for coordinating and supporting the health and well-being of citizens with learning disabilities. And that's illustrated by the quote here from a professional saying that organisations need to be better connected to spread awareness of the help and support that's out there. Our key recommendation in this finding was that we recommended that a learning disabilities friendly GP accreditation scheme be set up in Birmingham, and this would take on functions such as training staff, improving data collection, improving the consistency of services and promoting adverse weather advice. Our report includes some research which suggests that those with learning disabilities may be at more risk of adverse weather, so we've included that as part of this. Raising the importance of cancer screenings, and I've highlighted that data which shows that there's a huge inequality in the access to those, and a network of primary care learning disability champions. So that was based on an example of good practice that we saw elsewhere in the country, where a learning disability friendly award scheme was set up and which was able to support citizens in accessing healthcare. So we thought that was a really useful thing to adopt locally. Secondly, a standardised hospital passport to be agreed and utilised across the West Midlands. So some of our findings were that there's lots of different types of hospital passports being used, but there's no kind of agreed way of doing this, and the standardization could improve the quality of those. Our second key finding was about a lack of data. So like I said, sometimes we didn't have data at a granular enough level for us to provide as much detail as we'd like to as researchers. And so we need to have a fuller understanding of the size and needs of the learning disability population. A Birmingham professional said that there's no support for professionals to be able to gain knowledge and information, and then to provide effective support for those with learning disabilities. And that kind of illustrates this as well. We recommended, as part of this key finding, to develop our data and share it across the system to support commissioning priorities, but also public health analysis. So that's where we come into the picture of creating detailed evidence-based reports, which then can be used across the system by professionals and to support the work that everyone is doing. And secondly, we recommended for the lobbying for cancer screening databases to include learning disability flags and for letters to be produced in easy read, which, as I said, is an accessible form of communication, and to pilot these with follow-ups and non-responders. Our third key finding was about opportunities to improve the identification and assessment of citizens with learning disabilities. And a parent said through our research that people say that their son just doesn't look like he's got anything wrong with him. Not understanding, they say a lot of disabilities are hidden. And I think people with a learning disability are sidelined because people assume a disability has to be visible. Our recommendation that I wanted to highlight under this key finding is to support a system-wide rollout of the Oliver McGowan training to not only health and social care staff, but emergency services staff, criminal justice system staff, and healthcare responsible for cancer screenings, to raise awareness of the understanding of learning disabilities so staff can easily identify citizens more quickly and support their needs. Oliver McGowan was unfortunately a case of a young person who died and whose parents took up the idea of creating better training for staff on learning disabilities, but also autism. And it's been included in the Health and Social Care Act and is now mandatory for staff working in CQC registered services as well. The last key finding that I wanted to highlight from our report is that there is a demand for improved services through person-centred and consistent care across the city. So here about Birmingham Health Professional, a quote from them is that people with disabilities should have key visible roles and should have input on the decisions that affect them. One of our recommendations under this key finding is to review the findings and learning from the Pregnancy to Parenthood CASBAR project with a view to making it a citywide offer. CASBAR is an advocacy service carrying out independent advocacy for people with learning disabilities in South Birmingham, and they provide a range of groups and one-to-one advocacy support, as well as training and workshops. And they also provide the Pregnancy to Parenthood programme, which supports those who are becoming parents with learning disabilities. And so that, along with other services, is highlighted in our services chapter as well. And secondly, there to improve the offer of locally supported employment programmes for those who want to work and increase the accessible applications that are out there in response to that research that I mentioned, that not only are citizens with learning disabilities less likely to be in work, but one of the key barriers to that is accessible forms of applications. So I also wanted to highlight that we, as well as our report, which is published online, we also created with Easy Read Online a easy read version of our report outlining what we found and why we conducted that report. So I think Ellie might be able to pop the links in the chat again to our work, so you can go see that, and feel free to share that as well, because we're really you know, it was really important to us that it was accessible to all. So I'm going to pause here for questions, and before I move on to talk a little bit about our work on neurodiversity, so I don't know, let me see if I can see if people's hands are up.
I can.
Dave. Yeah, go for it, Ellie, if you want to manage this.
Dave.
Good afternoon, colleagues. First of all, congratulations to the Public Health team for doing such an excellent piece of work and presenting it back to us. Just several observations, really. My first one relates to the annual health checks. It's good to see that there's been a substantial increase in the number of checks undertaken, but my big concern is that we don't have a quality standard for the health checks, and therefore they vary in such quality and competence that you can see in the leader figures that there's not really huge benefits coming through from health checks. And I think the fundamental reason is that lack of a quality standard. And I think we could really lead the way in Birmingham, working with our NHS colleagues to establish that. And it's good to see among the recommendations GP-friendly primary care, learning disability-friendly GPs. So I think that's the starting point. And I don't understand the reluctance, if you like. There seems to be a real struggle to convince people that a quality standard for the annual health checks would be the most significant step forward in tackling health inequalities of the people. I think the second point, and again, this is, it sounds anecdotal, but this is factual in the sense that we support a lot of people who unfortunately find themselves in hospital for a variety of reasons. The hospital passport system that we have is perfectly adequate. It's just, and I make no apologies for this, it's just almost completely ignored by frontline professionals in the hospital setting. So I think it's another important piece of work, and standardising it would be great. But going all the way back to the Learning Disability Partnership Board days, the development of the hospital passport in Birmingham has been actually one of the most interesting pieces of work. My third and final point on what we've heard this morning around employment, I think the biggest piece of work is working with employers rather than, if you take the Chamber of Commerce, for example, and I've had these conversations with them many times. The issue is the actual labour market and preparing employers to actually employ people with learning disabilities and autism. And I think we could do a really significant piece of work in Birmingham by engaging, say for example, the Chamber of Commerce around a whole learning disability autism awareness program for potential employers. So again, those are the points I wanted to make from what we've heard from the slides. And again, congratulations to the Public Health team for the work in undertaking and delivering on the deep dive. Thank you.
Thank you so much, Dave. I think those are really, really important points. And I suppose what's really interesting with our work is that completing the report doesn't mean that this work is kind of finished and is, that's it, end of that chapter. We really want it to be a living piece of work which continues to influence the system and beyond just this report, but for us to gather that learning throughout our future reports. So in a second, I will move on to talk about our current work on neurodiversity, but I think your points are really, really relevant to continue thinking about that and how we can bring those into our other pieces of work as well. So thinking particularly what your last point there about employers, working with employers and influencing the system in that way, I think is something that as a team we can definitely look into. And your other points were really important as well. So thank you. And yeah, definitely it's about continuing those conversations and continuing to think about how improvements can be made, definitely. I can't see names. I'm so sorry. Ellie, are you able to introduce the next question?
Hajra has her hand up. She asked a question in the chat a second ago that might be about the same thing.
Yes, it's related. So I was just wondering, that's quite a significant increase that was seen in kind of people with learning disabilities taking up the annual health checks. I was just wondering if we knew if there was something that was being done that caused that. And I just based on what Dave just said, I think it's quite important that we're not just putting more resources out there for people with learning disabilities and their family to use without kind of following up with suitable training opportunities within the NHS and other public services to make sure that they can be interpreted correctly. So like the passports, for example, are a great example of how, you know, someone with learning disabilities can go in with the intentions of expressing their needs and what they want their care to look like. But if you've got someone who's never worked with someone with learning disabilities before, or doesn't know how to interpret that information or kind of action that and take kind of practical steps to improve that person's care and make it work for them, it's quite difficult to make that as the passports as impactful as they could be. So yeah, I think it's really important to kind of just think long term about how we can embed these things into kind of like whether that's mandatory training or yeah, I don't know what the answer is, but I think that's really important.
Yeah, I think that's a really good point. And I think we try to work with stakeholders all throughout the development of our reports, right from the off, to understand not only, you know, what the research is saying, but how to create those recommendations where the points are for change and how those could be brought about. So definitely a good point. And just going back to what you said about the increase in annual health checks. So the data runs over COVID, which could point towards the fact that these were maybe being conducted over the phone, maybe reaching more people that way rather than being in person. But we don't have much research around that to back that up and whether that affected the experience that people were having. So yeah, it's sort of, we didn't have yeah, lots and lots on that.
Dave, you still have your hand up, but that might be from before. So I think I'll go to Chris. Chris also has his hand up.
Thanks, Bethany, and thanks, Ellie. It's a really interesting presentation, Bethany. Just following up on Hedra's question about health checks, and I appreciate that it was over COVID, but was there any evidence that the actual number of health checks increased, or did GPs just get better at tidying up their data, so the actual increase didn't mean any more people got health checks, it just meant the denominator changed? Because I think the local NHS tried to clean up their records over the last few years, and I wonder if that had anything to do with it.
That's a really interesting question. And unfortunately, I am not the data guru on this piece of work, but I will have a look into that and I will email you a response, because that's an interesting point and one that I think I wouldn't want to give the wrong answer to. So yeah, thank you so much.
No worries.
And then Samira, she has her hand up.
Hi, I just want to say thank you so much for the presentation. It's really good, and I think it's just refreshing to highlight the needs of people with learning disabilities and actually where we need to do a lot more as a system. But also, I suppose, in response to some of the questions and comments that have been raised, there is quite a lot of work that's been done as a result of this deep dive within health and the ICB, and also through the Autism and ADHD Partnership Board in terms of the work that we're doing around employment, and also the Pure Project as well. So, and the leader work that's going on. So I didn't want anyone to feel like it's just been done and then it sits in a library somewhere. A lot of us professionals that are very committed have taken the learning from this and are working to try and solve some of the issues. We haven't got solutions to everything, by no means at all. And I think if there's people on this call that are interested in supporting and helping out, we've got lots of groups. So we've got the Quality Champions team as well, which are a group of citizens that with lived experience, and they do a lot of work to support us. So if anybody is interested, do please reach out, because I think the more heads that we can get in this space to make change, the better, really.
Thank you so much for raising that point, because I think that's so important to say. And I think something that my slides are, you know, my slides have tried to highlight the inequalities that our research has highlighted, but actually our report also highlights a vast array of examples of good practice, work going on in this field. And it's definitely important to say that there's so much going on, and this is like you said, it's an ongoing conversation, it's an ongoing development, and we are returning. So one of our recommendations is that we as a team review this field in 5 years and be able to give updates on all of that. But as you say, some of the changes and work going on will be shown in our other work on neurodiversity. We might have time for 1 or 2 more questions, and then we might move on to just to talk about a bit about neurodiversity.
I don't know who was first. I will go Is it, sorry, apologies if I'm pronouncing your name wrong, Adewale?
Yeah, Adewale, Adegudu, yeah. If it's more of a comment very quickly regarding the question on how the data is improved in terms of people coming for health checks, etc. I think just as to put it in context of why I'm making a comment, I work as a scrutiny officer on the Health and Social Care Committee for the council, and we do work very closely with our NHS partners, etc. And I think from what they've been telling us, one of the reasons for such for data improvement is it's become especially in the last 18 months, it's become for the ICB, it's become almost a number one priority to get the data absolutely spot on and to improve and have that data drive and data improvement of how they collect people coming using the services across the board, and that includes obviously people coming for health checks, etc. Particularly in Birmingham, where we have a super diversity issue, which is obviously a positive issue, but the negative aspect of it is people are getting missed out, and so the whole idea is to improve that data collection and also to be able to sort of investigate where the low level of engagements and how we can actually improve that across the board within the ICB and NHS, and working closely with the council as well in terms of adult and social care teams, etc. So I think that's where you find why there's, and hopefully that would continue, and it's something that the NHS are really working hard and the ICB are working hard to continue to improve. Just to give a kind of a context on that, that's all, you know. But as you say, the work doesn't stop, it continues. So it's really good to see this project making things happen. Thanks.
Yeah, thank you so much for your insight. That's really, really interesting to know. I think we'll go for one more question, and then we can have more time for questions at the end.
Yeah, Dave has a final question for now.
Thank you. Yeah, my point, if you look at the BSOL, the leader report, this is leader report, the age of deaths for people with learning disability and autism in Birmingham has reduced again. You know, there's lots of reasons for that, but I think it does tie back to what we just heard about the annual health checks. You know, the scrutiny of that. You know, I made the point a bit earlier. Unless we underpin that annual health check with two things, one would be a quality standard, but so few of those annual health checks actually have a health action plan attached to them as a conclusion of that. And I think we need to be able to ensure that when we're scrutinising actually what's happening, you know, with you know, the health inequalities faced by people with learning disability and autism, that's our starting point. Even if we are doing all of those health checks, unless they're connected to health action plans, things like social prescribing, screening, and all those sorts of things, that's, you know, fundamental to the reason why people are still dying so young.
Yeah. No, I think those are really good points, and definitely things that we will investigate in our, you know, current work, because I know that there's a pilot on the use of health checks with citizens with autism as well going on at somewhere in the country. I'll have to go back to the research, but no, really important points, things to think about, and things to continue to talk about. So we'll have some more time for questions at the end, but I just wanted to highlight our current work on neurodiversity, because this is a deep dive that we're working towards for next year. And neurodiversity here, what I mean by that term is the idea that people's brains work differently, they think differently and might learn in different ways, and there's lots of different definitions of neurodiversity. People have different views on what conditions come under that umbrella term. So what we've done is to identify 5 conditions which really commonly come under the definition of neurodiversity, and those are going to be the scope of our report. And that includes autism, ADHD, dyslexia, dyspraxia, and dyscalculia. We know that over 9 million adults are living with neurodiversity in England. And I just wanted to highlight some famous faces of people in the media who have said that they've got ADHD themselves, because I think that's always really interesting to kind of see some examples of people that we might all have heard of. And through this report, we're going to be researching a huge range of topics. I'm sure you've kind of seen the kind of vast array of things that we look at from the slides so far, but the things that we are going to be covering in this report include the strategic context, prevalence, health inequalities, physical health, mental health, education, employment, housing, transport services. There will be lived experience, and what we are really interested in doing is inviting you to put your email address in the chat if you would like us to be in contact with you about hearing your insights as professionals that may be interested in either shaping our research, to sharing your insight about research themes that should be included in our reports, or if you're aware of some research or data that you think should be included, or if you want to point us towards particular services or connect us with somebody else, that would be fantastic, because we're really interested in collaborating with stakeholders on this project. And this is the perfect opportunity to say that we have just launched 2 questionnaires. So we are going to be commissioning lived experience with citizens and parents and professionals, but we also have our own questionnaires that we put onto Be Heard, which is the council's kind of consultation website. And so far we've launched the Be Heard questionnaire for parents and carers of children with neurodiversity, but also professionals. So Ellie's going to put the link to those in the chat now. And we are currently in the process of developing with co-producing with the Quality Champions team the questionnaire for citizens with autism and ADHD, dyslexia, dyspraxia and dyscalculia, which we're looking to develop on a different platform, because we don't think that Be Heard necessarily supports all elements of accessibility that we would like. So it's sort of still in development. We're trying to do our best there, but we can send out the links to the ones for citizens in the future via email if you're interested. And please share these links with your networks. We would love to hear from as many people as possible. And that brings me to the end of my slides. So there's more time now. If you would like to ask any further questions, please do put your email address in the chat and we will contact you to be in touch about hearing your thoughts about our neurodiversity deep dive as well. And I'll pass over back to Ellie to let us know who's got questions.
Yes, Samira, she has her hand up.
Thank you, Ellie. I think for me, it was just another thing that had obviously been highlighted in terms of the leader report and within the deep dive around people from ethnic minorities that have a learning disability and pass away even younger than the status that's been suggested in the report. And I suppose I'm quite curious to understand, because obviously you said Manchester's got a lower rate, so it'd be interesting to see what they're doing in Manchester that we need to be looking at, because I think in terms of comparison, in terms of diversity within a large city, it'd be really good to understand kind of what Manchester and maybe Bradford, what the comorbidity there would be, and what they're doing differently that is working. So I think for me that's an area that we really do need to focus on as a city in terms of supporting people from ethnic minorities to get access to health checks, to make sure that information is in the right language or appropriately, the appropriate use of translators and interpreters, because I think that's quite key for some of the things that citizens have raised with me about those barriers to accessing care and support.
Yeah, I think that's a really good point. We definitely want to learn from other local authorities and learn from best practice elsewhere. I think the Manchester numbers were actually in regards to employment. I think I mentioned a few slides ago. So Manchester have the lowest employment rate at just 0.9% for working age people with learning disabilities, and Leeds had the highest at 8%. So what we did is we contacted Leeds to try and figure out what they were doing differently, and we had some great meetings with some staff from Leeds local authority. And one of the things, for example, that they said, this isn't about health check, but I think it is kind of speaks to what we tried to do as a team to contact other people and learn from them, is that they had a website of jobs which was an easy read website. So an easy read job website for people to look for jobs and apply for those jobs all in easy read, and we thought that was really amazing. So yeah, things like that we definitely want to learn from other people and what we can be doing better.
Brilliant, thank you. Sorry, just on that note, I was just wondering, are you linked with our internal HR team as well?
I am not sure. I can double check.
If you're not, Ellie's got my email address anyway. If you just reach out, I can try and connect, because I think that example that you've given is really important, and actually we shouldn't be asking other organisations to do something that we're not doing. And I think if we can link that in and actually start changing the way we advertise jobs, I think that's really important. So yeah, Ellie's got my email. Let me know and I'll connect people.
Thank you so much. Thank you.
No problem.
Hadra?
I was just going to give some kind of like themes within themes that I would really like to see in the neurodiversity deep dive, and I think will probably come up naturally through research anyway. But I think gender and disparities are going to be really important. I think late diagnosis and underdiagnosis, particularly for women, and the kind of different presentations and how those are kind of giving women like just so much difficulty with getting diagnosed is really important. And I also think the role of the private sector and issues with continuity of care between the private sector and the NHS. So it's quite common now for people to go private for a diagnosis. If you go private for a diagnosis, you also have to be kind of either, if you want to go down the medication route, you'd have to be prescribed medication by that private clinician, or go and wait in the NHS waiting list, which some people can do. But there's a lot of issues now where even GPs won't manage people's medication for ADHD and things like that, because the what am I trying to say? The integrity of private diagnoses is coming into question. So there's basically this cycle of people trying to get help from other places, but then that help being not the right way to get help, and it actually slows the process down. So yeah, it feels like women and also the kind of relationship between the private and public sector feels like really important parts for that. But yeah, it sounds like a really fantastic project.
Thank you. That's really, really interesting. I think we've definitely started to pick up on the research around gender inequalities, but maybe less so about that relationship between public and private services. So that's definitely something we'll look into. Like I said, if anybody on the call is interested in just having a quick on Teams meeting, really casually over Teams with us, we would love to kind of hear your insights and thoughts like that, because it's that kind of insight and experience that then helps us to shape our research and how we can kind of explore different research themes. So we'll definitely pick that up. Thank you so much.
Adewale, you had another question or comment?
Yeah, just a kind of more of a comment really, but maybe quite a big question as well. It's just that I think that another one group or area that would be good to have a bit of a deep dive into as well would be again, looking at, if it's focusing on Birmingham, is the migrant community in Birmingham. The largest migrant community are students. We have one of the largest migrant student populations in the country. Obviously, many of are young people, and we don't, and I'm sure, certainly from relative experience, that there are people, or young people, or not just young people, but people from that community, migrant communities, migrant women who perhaps who are not engaged on this issue and don't know where to turn to because of isolation, loneliness, perceived prejudice, and stigmatization of their status. And the fact that they're struggling to make ends meet, not just financially, but also psychologically and socially within a I'm not afraid to say this, within a fairly hostile environment around immigration, etc. And that actually compounds the issue around the neurodiversity and the impact of that on citizens from those type of communities. So I think it's an area that will be interesting to explore. And in terms of engagement, I noticed on the call there's people from the CVS on this call and the NHS. They probably do reach out and are connected to groups, community groups that represent these communities, student groups, faith-based organizations. These are groups that perhaps are likely to know less about this issue than most because of because well, I don't know reason, but it's likely that they would. So in terms of engagement with these groups and actually identifying, because they're part of the community and they need to be. But of course, this is juxtaposed with the fact that the service levels in terms of provision of services is pretty tough. In terms of the demand on the services and actually being able to have access to the services that would help, and so that needs to have to be looked at as well. I just thought I'd mention that as an aside. Thank you.
No, thank you so much. And you know, I think where we go through our research process, uncovering as much as we can, but I think it's really, really helpful to gain your insight. And Ellie, if you could pop my email address again in the chat, if anybody would like to contact me directly or provide any, you know, research that you're aware of, point me towards any books or articles, but as well, if you want to chat further about how we can be, you know, disseminating our questionnaires to, you know, groups that are maybe under represented in research or underheard, we would really love to work with you about how we could do that. So thank you. And I think for anyone else who's just joined the call, I think Ellie's also put in the chat the links to our parent and carer and then professionals, neurodiversity, lived experience questionnaires. So we'd really love you to take part in those. And then our one with citizens is in development, but we will be emailing that out after as well once it is finished. So thank you so much. Are there any further questions or comments? If not, then I would just like to thank you all so much for your time. I really hope that this was interesting. I'd really encourage you all to take a look at the full deep dive that's published. And please, please, please do get in touch or pop your email address in the chat if you'd like us to get in touch with you to chat about any of this further. We'd really love that. Thank you so much, everybody, for joining.
Thank you.
Thank you. Bye.
Thanks very much. Bye.
Did it get recorded? Because I unfortunately missed the beginning.
Yes, it's been recorded. And we'll, if you pop your email address in the chat and say that you'd like a recording, we'll get you on.
Thank you so much.
You're very welcome. Thank you, everyone.